Way to Life is a medically directed program, and what we try to do is focus on healthy lifestyle changes.
I knew it was something that was legitimate and offered something that could be more life-changing than a regular quick weight loss program.
So if people are eating healthier, if they're moving more, they're dealing with some emotional things that may cause them to overeat, then we feel that they've been successful.
I've got 3 young children, all under the age of 12, and I really didn't feel like it was fair to them that I was being held back by weight. Everyone's got a reason why it needs to happen, and why there's a reason in their life why they need to stay alive and be healthy, and the Heart Institute here has the most incredibly healthy approach to weight loss and living that I've ever come across.
It's taught by registered dietitians, exercise physiologists, and behavior specialists.
Where can you go to have all these professionals available at any time to help you?
Each week we will cover a different topic, and these topics could range from how to start an exercise program, how to read a food label, how to eat out healthier. Anyone can join our program. We've had people that are very overweight, we've had people that aren't very overweight. The doctor does not need to prescribe the program. Anyone can walk in and sign up for our program.
It's just amazing the confidence that they've given me here, and I really believe they've given it to me, because I couldn't have founded a quick fix weight loss program. I needed the whole bigger picture to be a healthful approach.
A lot of people refer us to their friends or relatives.
They'll say, gosh, how'd you do this? Or where did you go? And I'm always very quick to say there's this wonderful program that's a very well-kept secret that's just amazing. And I've had a few friends that have come over and done the program since then and had wonderful success.
Anyone who calls right now to 314-TOP-DOCS to find out about Way to Life will receive a free heart health kit with an exercise resistance band and a coupon for a discount for the 12-week Way to Life program.
Now, we would like to introduce you to Kimberly Lovelady. She is a health educator with the American Heart Association. She offers an amazing and sometimes frightening look at the damage heart disease causes in actual human organs. We do caution you that these are real organs from human donors, and the effects of heart disease, smoking, and obesity can be startling. But this is such compelling evidence that we think everyone should see it. So please watch this very important presentation.
I'm with Kimberly Lovelady. Welcome.
Oh, thank you.
She's a health educator with BJC, which means you teach people a lot of things about their health and their bodies.
Right. Our goal is just to make sure that everyone we come in contact with is as healthy as they can be. So.
All right. So, which of these is the healthiest? And we're looking at the aorta?
Yeah, we're looking at the aorta, which is the major artery into the heart. And this one is a healthy one. It has very little fat on the back of it, as well as on the inside, it's nice and smooth, very little plaque. I mean, we're all going to have just a little bit, just from natural diet and exercising. But it's very soft, it's very open, it's not hard anymore.
But by and large, this is a healthy aorta.
That's extremely healthy, because if you look at the smokers, this is one that we've taken out of a smoker's body. You can see the plaque build up and the fat. But normally your arteries are very small. This is just a major one. So even this little amount can clog the artery, and that's to block it, and there's the heart attack. So this one is healthy as well, but as you see, that it's very nice and soft on the inside with no plaque buildup. But as you see on the outside, there's some fat starting to accumulate, so you know that this person probably is not as healthy as they could be.
Let's move over to the heart. We have 4 hearts here. The difference? Starting with this one.
Well, this one is really neat, because this lady, she was 90-something years old when she died. All the brown stuff you see is the muscle, and just a little bit of white stuff you see is also the fat.
And where the blood flows, we see it's a large opening.
It's a very large opening, which allows a lot of blood flow in and out of the heart, and that's what you want. You want a nice opening, because the smaller it gets, the more stress.
Likely you're going to have a stroke.
The more stress on your heart. When you move to the next heart, this person was a lot younger. The first thing you notice is a lot of fat around the heart. If you look at the opening of the heart, for the blood flow is extremely small, and the walls of the heart are very
So that was a young person's heart, not a lot of activity, and probably a bad diet.
Probably a bad diet.
All right, what does this one tell us?
Okay, this is a young person as well. The first thing you see is fat once again, and this heart is getting larger. When we're not eating as well as we can and we're not exercising well, it's going to take a lot more to get that heart and the blood flow pumping through the heart. The heart has to work a lot harder, and because it's a muscle, it begins to expand. If you actually look at the heart, if I show you right here, that's where the major blood flow is going in and out. And if you can see, this one is very small. They're getting very little blood flow, which means that not enough blood to the heart, we're going to probably die of a heart attack.
And this last heart.
Once again, another enlarged heart, just really showing you that the more that, you know how some people go, oh, I'll exercise later, I'll eat right
I'll get
later.
around to it.
Right. As you keep getting around to it, and we never actually sometimes get around to it, the more you push it off, the more stress you're giving to your heart, and the larger it has the opportunity to become.
People make that statement, I just need to lose 5 pounds. That's all, just 5 pounds. So, this is 5 pounds.
And how does it feel, Robin?
Heavy. A lot heavier than I would expect 5 pounds.
5 pounds of that can start leading to this.
Translates to a larger heart and an unhealthy heart.
An unhealthy heart. 5 pounds of that leads to this.
Wow. Thank you for all of this information. I think we all learned a great deal.
Oh, thank you very much for letting us come out and show you what we have so that we can get the message out.
Thanks.
I just didn't put all of the symptoms together. I was in a complete state of denial. They put me into the hospital and they did a cardiac catheterization and whisked me right off to the operating room for a triple bypass. I now have 6 grandchildren and another on the way, and I would never have seen any of those children had I not had bypass surgery. So I am truly a blessed person. I have a wonderful family, I have a huge support of friends that are always there to help out, and I'm blessed.
The American Heart Association, through extensive clinical and statistical studies, has identified several factors that increase your risk of cardiovascular disease. Now, some of them can be modified, treated, or controlled, and some cannot. The more risk factors you have, the greater your chance of developing coronary heart disease.
And also, the greater the level of each risk factor, the greater the overall risk. For example, a person with a total cholesterol of 300 has a greater risk than someone with a total cholesterol of 245, even though everyone with a total cholesterol greater than 240 is considered high risk.
Now, we'd like to discuss the non-modifiable risk factors for heart disease. These are things that you cannot change or modify, but directly increase your risk of heart disease. So if you can't change them, then why should we even discuss them? Because the risk is compounded and cumulative with each modifiable risk factor that you have. For example, the first non-modifiable risk factor is age. If you're older, your risk of heart disease is higher. But if you're also overweight and smoke, your risk for heart disease is greatly increased.
It is a simple fact that as you get older, your risk for heart disease gradually increases. An advanced age significantly raises the risk of heart attacks or strokes. But this doesn't mean that younger people are immune. 1 in 10 women aged 45 to 64 has some form of heart disease. The rate increases to 1 in 5 for women 65 years of age and older. And in fact, over 83% of people who die of coronary heart disease are 65 or older. And at older ages, women who have heart attacks are more likely than men are to die from them within a few weeks.
Before menopause, women have a much lower death rate from coronary attack than men. Women's risk rises sharply after menopause, but it still remains lower than men's in the same age group. But each year, more women than men suffer a stroke.
You can't change your family history, so why worry about it? Because it is important for you to know what runs in the family and tell your doctor. Talk to your parents, grandparents, siblings, aunts, and uncles about who has had a heart attack, stroke, or other serious health problems. With this information, your doctor can then recommend screening tests and preventative treatments as appropriate. Also, African Americans are more likely than Caucasians to have high blood pressure, and they tend to have strokes earlier in life and with more severe results.
If you have any questions about your risk factors for heart disease, you can call 314-TOP-DOCS until 8:30 this evening to talk to an expert from Barnes-Jewish Hospital.
I was 39 years old. I was in great shape. I worked out 3 or 4 times a week, and thank goodness I knew something was wrong that I was able to get to a doctor's office. Turns out there was a blood clot in one of my coronary arteries, and they finally attributed it to stress. I don't sweat the small things anymore. I used to do that a lot. I know my body really well, so anytime something's a little bit off, I make a phone call, and I cringe to think if I hadn't done that at the time, if I had just kind of blown it off, I would have coded right there in the house, and that I know I would have been dead. So.
During this program, we've presented you with a great deal of important information. Now it's up to you to take the next step, to follow through with the advice from our experts. See your doctor and find out your critical numbers. The more you know about your risk factors for heart disease, the better your ability to control your health.
And remember, even after the show is over, there are several ways you can still access important heart health information from both Barnes-Jewish Hospital and the American Heart Association. Until 8:30 p.m. tonight, experts from the Washington University Heart Care Institute at Barnes-Jewish Hospital are available to take your questions. Call 314-TOP-DOCS. Staff members are available to answer questions about your heart health. Call Top Docs or log on to www.barnesjewish.org right now for a free heart risk assessment.
Anyone who calls right now to 314-TOP-DOCS to find out about Way to Life will receive a free heart health kit with an exercise resistance band and a coupon for a discount for the 12-week Way to Life program. By calling the American Heart Association at 1-888-MY-HEART, they will enroll you in their monthly newsletter full of heart-healthy information. Or you can go to your computer and log on to their website at www.goredforwomen.org. And anyone who would like to volunteer with Go Red for Women locally is invited to either call or email to lend a hand to this great cause.